Sorry. My computer sound little thing isn't working.
No worries. I'm using someone else's computer. I know it says Holly, but I'm Anna Adams. So I
Hi,
understand
Anna.
computer difficulties.
Sorry
Thank you so much.
about that.
No worries. We appreciate you being willing to talk to us. Thank you very much.
Sure.
I think we just want to get a perspective of Friday's events from you and just the subsequent actions you took after that. So if you could just walk us through when you first got the notification that there was an emergency at the Unicoi Hospital and then your subsequent actions after that.
So we received notification to evacuate, I think around 9:30. At 9:38. And we were well on our way. When you evacuate, there's certain things you have to do to get the patients ready, call in the ambulances and all that kind of stuff. And all that happened. And they began that process, and we're trying to get the patients evacuated. And somewhere around 10 o'clock, it became apparent that that they were having difficulty. They were having difficulty because of the water. The water was starting to come in really fast. And I remember about 10 when we had a physician there who has a lot of experience with this, and he was FaceTiming with us so we could get, lay eyes on what was going on. And it was pretty alarming to see the water. And there was actually some discussion about whether to carry the patients across the water. I think we made the determination that would not be safe. And we, what'd you do?
It's gonna keep falling asleep.
Well, I just lost it. I've got the timeline here in front of me because I can give you accurate data. But so so about when I saw the water, that was about 10:15. I called the governor's office, and they put me in touch with the director of TEMA. So at I think like 10:16, I spoke to the director of TEMA to tell him, look, the situation there I think is going to get bad because we're trying to evacuate. Water's coming in too fast, and we're going to need to come up with some alternative plans. And so we instructed them to put the patients back inside the hospital and secure them. They sent boats. They sent swiftwater boats. The swiftwater boats got there at I don't remember what time, but they got there fairly quickly. The problem was that water was rising so fast, it wasn't safe for the swift water boats to be able to get over. So then they called in some motorboats, and the motorboats actually got to the hospital. But again, the water was, by that point, there was so much debris coming down the water, it wasn't safe for the boats to come back. So now we had even more people there inside the radius of the hospital. And when I say there was debris, I mean like trees and pieces of house and stuff like that. So it clearly wasn't safe. And by then, water was starting to intrude to inside the hospital. And so we decided to go ahead and have the patients and the staff move up to the roof to keep them away. I mean, the hospital, the water line in the hospital is easily more than 7 feet. I mean, it got up to the top of the almost to within a couple of feet of the top of the roof. And so there were some patients that they couldn't get to the roof, either because of the size of the patients or just their complexity. And so we made the decision to put those patients with clinical staff in the boats, and they secured the boats. They tethered them to the hospital, knowing the water was rising. They tethered them and put them. There's a section of the hospital that's downstream, on the downstream side of the hospital. The water was more calm. So, it was a really dangerous situation for everybody. And the problem was they couldn't get helicopters. We had been in touch with the National Guard as well as through TEMA, as well as the Virginia State Police, and the helicopters they were both pushing to try to get helicopters to get airborne, but the wind was still too high. So it was dangerous for the helicopters. Um, the Virginia State Police helicopters are actually staffed with Ballad Health employees. We have medical flight nurses that staff the Virginia State Police medical helicopters. And so we already had a direct line of communication with the Virginia State Police. And frankly, they told us as soon as it's safe to do so, we'll take off. And we've been ordered, or we've been approved by the governor to use our resources. So fortunately, once the wind died down enough, we were able to get the helicopters airborne and get them to start doing evacuations. And of course, the National Guard, the Blackhawks came not too long after Virginia State Police got there, and they had a constant movement of both Virginia State Police and the Blackhawks doing evacuations until everybody got off safely. I remember once I knew the helicopters were starting to move patients off the roof, I drove down to Irwin myself to greet them when they got to the school. And I remember our first nurse getting off the helicopter. He gave me a big old hug, and then he said, "Where's my patients?" He wanted to go check on his patients. And I mean, there's a lot of things that I saw that day that were really inspiring. Number one, that we saw first responders rushing into the danger zone, and they got stranded. I mean, the lady from TEMA was actually stranded on the roof along with our employees, as were some of the Swift River boat folks. So first responders were as much in danger as our own employees. For me personally, it was a little tough because my wife was in Asheville and my daughter, and I couldn't reach them. So I had no idea. I mean, like so many people, we had loved ones that were in a real dangerous area and had no ability to communicate with them. So it was a tough day. Actually, Saturday was really hard because just seeing the hospital submerged in water, it looked like it was floating in the Atlantic Ocean. I mean, you've seen the images. So
Yes.
I, I'm just grateful that everybody got out safe. I mean, the end story is a very positive one. That everybody is safe. We're certainly providing services to our employees who want them. Employee assistance program. We've got counselors, that have been leaning in, that have gone out to meet with employees, because I think it was a pretty traumatic event for them, and so our concern is for their well-being and to make sure that they're okay.
Absolutely. And at any point, were you in contact with the Virginia governor, or had you just contacted some Ballad Health employees with the state police?
No, we were speaking directly with the commander of the Virginia State Police in
Okay.
Southwest Virginia, and I spoke with the Virginia governor's office, his chief of staff.
Okay. Okay. And at what point was that? When I know you contacted Tennessee first, and then at what point did you contact Virginia?
I would say it was probably closer to early afternoon. I mean, we were in touch with the Virginia State Police, I'm sure before noon, because we were trying to assess whether there were helicopters that could fly. So there was two different issues. One is our emergency operations center people were speaking actively with Virginia State Police at the same time, and with the Senator Todd Pillion in Southwest Virginia, who was at the emergency operations center in Southwest Virginia. Um, I spoke with the governor's chief of staff probably later on, after that, just to make sure they were aware of what we were dealing with. Um, but I mean, there was a lot of communication going on at multiple levels, because
Mhm.
we were also I spoke several times with the Washington County Mayor Joe Grandy, with Carter County Mayor, because while all this was happening, we also had to make some decisions about Sycamore Shoals,
Yeah.
because the TVA was going to release, they were going to open a release, I think some kind of pressure, or they were going to open some kind of floodgate, which would make the river behind Sycamore Shoals rise. And we were concerned about that. So we also had to evacuate Sycamore Shoals at the same time. We were dealing with the issue in Unicoi.
I see. And obviously, I assume your staff has never dealt with a situation like this ever before, but I feel like their response time, being able to keep all the patients safe is quite incredible. What training had they gone through for disaster relief, or had you prepared them for potential evacuation before this?
Yeah, that's a great question. And the reason I'm smiling is I was the Secretary of Health in Florida in 2004, 2005, when the two major hurricane seasons hit. I think I managed the healthcare response in Florida. I think it was 10 major hurricanes. And then later on, I was the Secretary of Health in Louisiana when we had hurricanes Gustav and Ike. And actually, that was when we evacuated New Orleans for that, that was the largest single uh, um, evacuation of an American city in history. So I've been through a lot of these. Plus, I was also responsible for responding to the Deepwater Horizon oil spill. Um, and what I would tell you is through what turned out to be like 12 major hurricanes and an oil spill and a pandemic, and well, actually two pandemics because H1N1 and then the COVID. Um, you learn number one that every disaster has a different personality and different set of problems. And but one thing is commonly true: whatever your plans are, they're going to fail, because there's things you just can't predict that happen during a disaster. When I came here, we established the command center, what I call a corporate emergency operations center, and it was established based on my experience. The policy we drafted was based on how state functions work, based on my experience at the state level, where you have communications functions, utilities, transportation. So we have teams of people working on things all the way through in the entire time our emergency command center is activated. So, and I'll tell you just a little story. When I was Secretary of Healthcare in Florida, we had Hurricane Katrina had already hit Florida and was on its way to New Orleans. And I got a phone call from a CEO of a hospital in New Orleans asking for fuel for their generator. And I said, well, I'm happy to help, but why are you calling me? I'm in Florida. And they said, well, the EOC in Baton Rouge is overwhelmed and they can't help us. I said, okay. So I started the fuel, that I got the National Guard to start shipping the fuel. And about an hour later, the CEO called and said, cancel the fuel. We're not going to need it. And I said, okay, great. You got fuel? He said, no. We're our generator will be underwater if the levees break, and it won't the fuel it won't do us any good. I said, well, then you're evacuating. He said, no, we've been ordered not to. And we all remember, Governor Bush called the governor of Louisiana and said, look, we've got 3,000 beds available in the hospitals. We've got C-130s. We can send them to you to evacuate your hospitals if you'd like for us to. And the governor turned down that request and said, but Governor Blanco in Louisiana said, thank you, we'll be fine. In fact, that whole story is actually, I think, in Governor Bush's book. But it was stunning, because what ended up happening is books have been written about it. People died in those hospitals because of the floodwaters. And so when I was watching this happen on Friday, um, it was something that I think our whole team was determined not to have happen. So I'm speaking, just everybody's got their story. My story is that we had the right people deployed at the hospital. Dr. Oceanbine has tremendous experience in dealing with stuff like this. The team at the Emergency Operations Center was actively engaged. And, one of the things that I've sort of asked everybody to do is deal with what's in front of you, but also you need to begin anticipating what's going to happen next. So, we're constantly leaning in, looking for problems to solve rather than waiting for those problems to confront us. And that's sort of the model for disaster management. Now, a lot of states have looked to Florida for how to do emergency planning, because Florida's just got so much experience. And that's where I got my experience, literally at being a part of the state emergency response team. And so I took a lot of those lessons learned and brought them here. And it's helped us. It helped us during COVID. We were very organized and we were always leaning in, and the same thing here. Again, a good example is evacuating Sycamore Shoals. When you sit there and you're doing planning and you think, okay, I mean, some people advise that, well, it's not likely that the river will flood. And I said, well, not likely means there's a pretty significant chance, because nobody would have ever thought Unicoi would happen. And so what can go wrong if the river floods and then we're having to evacuate in the middle of a flood? Well, that's harder than just evacuating the patients and being grateful if there's no flood. And so I think we've done the right things to protect patients and our employees. Sadly, we did lose an employee unrelated to Unicoi. We have a 32-year-old young man named Boone McCrae who on his own was trying to rescue somebody in his boat on Friday evening, and unfortunately, he and his dog, the boat capsized, and he and his dog both were found yesterday. And it's devastating for the team in Greenville. Boone had a huge personality and was well liked by the entire team at the hospital. So I think everybody's probably just dealing with that trauma right now.
Absolutely. And what resources do you offer your employees when they're dealing with the trauma of, the death of a coworker and also just the trauma of saving people and dealing with this hurricane?
Yeah, we have an employee assistance program, and we have deployed those counselors to meet with those employees. In fact, I visited Greenville Community Hospital this morning, and the nurse manager in the emergency department told me that the counselors were there a couple days ago, and it was so effective that they actually scheduled them to come back to meet with the rest of the staff that wasn't there. So the staff, they really do welcome the help, and they lean on it. And and by the way, we've not only offered that to our employees, we've made it clear to TDOT, because some of these bodies are being found by highway people from the Department of Transportation that are out clearing debris. And that's been the case. At least a couple of the bodies that have been found has had a profound impact on these people that are finding them. And so we've offered to provide those services to first responders as well as to the TDOT employees as well.
I see. And could you just tell me, if you have an idea, what is next for Unicoi Hospital? Are you planning on rebuilding? What are the next steps?
Well, right now, so the first thing we were worried about was having access to first aid available in the community. So we stood up a medical response unit. It's basically it's an air conditioned tent that has urgent care capabilities, and they're seeing patients every day. And so the next step, we're planning to open when we've already consulted with the state. I've met with Senator Rusty Crowe and with the director of the Health Facilities Commission about the process for getting a license to open a freestanding ER there. We already have an office building near the high school, right next door to the high school, in fact. And there's medical office space in there that we're going to convert to a freestanding emergency department. When that will be there in perpetuity until we figure out, what to do about, the rebuilding of the hospital. There's a lot that we have to do currently with the existing building, to mitigate it, and then to have the insurance adjusters look at it and have engineers look at it to see if the structure is even safe at this point.
I see. And have you been able to stay fully staffed at the hospitals or in the area, or have some of your staff also been, affected by the hurricane and displaced?
Yes and yes. We've had, well, I mean, as you know, we had a shortage of staff before this. We're suffering from the worst nursing shortage in the history of of recorded history because of the COVID pandemic, which we haven't totally completely recovered from. So we went into this, not fully staffed. But all of our staff have, this is what they train for, that when people need you, they're there. And we have team members working right now who've lost their homes, who've lost their pets, who've lost, a lot of their property, what they own. But every one of our team members that I've met, they have a really strong sense of resolve that, they're here to help their communities. And like I said, I visited several emergency management agencies. I was at Greene County this morning. I was at Carter County yesterday. I've been to the hospitals in Unicoi, Sycamore Shoals, in Greenville this morning. And without exception, every team member I've talked to, they're grateful. Number one, I must have heard it 10 times this morning. I've never been more proud to be a part of Ballad Health. I've never been more proud to be a nurse, because they see the hurt and the difficulty and the vulnerability of these patients that are coming in who've been exposed to a lot. And so I'm inspired by it. I mean, I'm really inspired. I'm inspired by the nurse who got off the helicopter. First thing he said is, "Where's my patients?"
Mhm.
That's a big deal. And so,
Yeah. All right. I think my final question is just, are you happy with how the state has responded in assisting both the evacuation and afterwards, and TEMA as well?
yeah, I think the answer is yes. I think the state and our local EMAs are doing everything they can do. This is I mean I this is I mean, I've been through 12 major hurricanes. I've seen a lot, and I've not seen such concentrated devastation like I see here. And so, I understand that people will get I think people will become less patient over time, and I understand that, particularly people who have family members that are still missing. But what I've been with the governor and our state leadership, I was with the governor the other day and with our state leadership, including our local delegation. Everybody is working as hard as they can. But this is an event that people in Tennessee and Virginia aren't used to. In Florida, Louisiana, you're used to this stuff, but this is a very unusual event. And I think we just have to work together. And so far, I feel like the governor's office has been extremely responsive, at least to us. I know uh, the emergent TEMA director Sheehan has been extremely responsive. There's not been a time I've called where he hasn't immediately responded. So I feel like there's good teamwork.
Absolutely. All right. Well, thank you so much for your time. I really appreciate it.